Okay, we are live.
Okay. Good day, everyone. Welcome to the last session of Ask the Pediatrician live session for 2022. We're here to take your questions. You can ask your children related question. And my name is Temitope Odekunle, a moderator, and I'm here with the CEO, Dr. Gbemisola Boyede. Please, guys, keep your question coming.
All right, good evening, everyone. For those on Instagram, I know you can see Timmy, but she's there with me here. So, welcome, everyone. Let's start asking our question. But before we do that, let's just share our. Let's share the video. Let's invite friends and family. I'm also trying to just share the video so that everybody can see us.
Yeah,
And
okay.
please, today is our last.
Yes, for
Live
2022, the last
for
session.
2022. I'm so excited. Yeah, it's been a long year, but I think we've been able to do ATP Live virtually every Monday for the past 1 year, and that's
Yes.
amazing. Apart from the public holidays, I think that's amazing. So today's your last time to ask a question live. Of course, ATP still runs until the 18th of December 2022, after which we usually will take a break um, for the year. We normally take a break for the last 2 weeks of the year so that all of us and our family members can enjoy this season. So you're welcome.
Welcome, everyone. Please keep your question coming.
Okay, so I just needed like 2 more minutes to just make sure all the videos are pinned, and then we'll
Okay.
be able to start. So I'm just trying to pin it now. Okay. And I can see those of you on Instagram. Welcome, 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 everyone. Okay, go to our live video. Okay, 1 more minute, and I'll be with us. So, just a reminder that if you are asking questions on Ask the Pediatrician's Facebook group, you can just put your question straight under the video comments and try and give StreamYard permission so that we can see your name. And if you're asking on Instagram, you can put it in comments, you can put it in the question box. If you are asking on our Ask the Pediatricians page, you can also just post your question on the video. But if you are asking the question on any of our other groups, ATP Family, ATP Silimum, FTM, um, uh, Care Baby Group, you have to click on the video so that you can get to the real video, and that is when you'll be able to post your question. Otherwise, we may not be able to see that question. So, but those on YouTube, Instagram, ATP Facebook group, ATP page, you can ask your question directly our from wherever you're watching, and we'll see those questions. All right, I think I've done all my pinning, and I think we can start. Right now, I
Yeah,
can see
we
any.
already started having some questions.
Yeah, just 1 minute. Okay, so I can see a few questions on Facebook, but I can't see any on Instagram yet. Instagram people, you're welcome. Please start dropping your questions. We have just 1 hour, and then we'll be good to go.
Yeah. Okay, good evening. Christabel said, good evening, doctor. Is how can meningitis be prevented?
Pardon me to take my sip of my tea. It's a little bit cold here. All right, so thank you so much, Christabel, for joining us and for asking that important question. So, for those who don't know, meningitis is an infection of the layers of the covering of the brain. So usually the brain is covered by what we call meninges. They're like about three of them. They cover the brain. So when there's an infection, bacterial, could be virus, could be fungal, most of the time bacteria, when they infect that covering of the brain, we call it meningitis. And sometimes it can spread to the brain itself, and you can have what we call meningoencephalitis, or it could just even be the brain itself that is infected, encephalitis, or it could be like pus is collecting within the brain, what we call cerebral abscess or brain abscess. Now, it's important to understand that this is one of the most serious infections, because we are talking about infection that is affecting the brain. Now, because there are different germs that can cause meningitis, so there are some of them that we can prevent, and there are some that are not preventable. But when we talk about very severe meningitis, we are talking about the bacterial meningitis. And when we talk about the bacterial meningitis, we are talking about those, especially for children in the age group of less than 5. We're talking about three major bacteria. We have what we call the strep pneumoniae, we have what we call Neisseria meningitidis, and we also have what we call Haemophilus influenza type B. So these three bacterial species, they are the ones that tend to cause the most bacterial infections that tend to cause meningitis in children. And luckily, all these three bacteria, we have vaccines. We have vaccines against Haemophilus influenza type B. We have vaccines against strep pneumoniae, or what we call the pneumococcal vaccine or PCV. We also have vaccine against Neisseria meningitidis type A in Nigeria. There are many type of it. We have type A, we have type C, we have W125 and Y and all that, but we have against type A. Luckily, that type A causes like 80% of meningitis due to Neisseria meningitidis, and we have a vaccine against it. The beautiful thing is that all these vaccines are part of the Nigerian program on immunization. So the number one way to prevent meningitis is to ensure your children are fully immunized. So for the Haemophilus is part of Penta vaccine that is given at 6 weeks, 10 weeks, and 14 weeks. The pneumococcal vaccine is also given at 6 weeks, 10 weeks, and 14 weeks, but it's given as a standalone. And then we have the meningitis vaccine, which is given at 9 months, along with yellow fever and um, chicken pox. I mean, sorry, yellow fever and measles. So those are the vaccines that we give. So all those vaccines are available. Sometimes when there's an outbreak, especially for those of you who live in the northern part of the country, what we call the meningitis belt of Africa, where we can have outbreak of meningitis from time to time, we do give what we call supplementary vaccines so they can immunize everybody, including adults and children. We also have tuberculosis, which can also cause meningitis as well. But we also have the BCG vaccine to protect against severe form of tuberculosis, which tuberculous meningitis is one of them. So vaccines are very important. And of course, general hygiene or avoiding overcrowding. Okay, these are all ways by which you can prevent meningitis. And if a child or anybody in the family already has meningitis, there are drugs that we can give to other family members to prevent them from having meningitis. So those are the ways by which we can prevent meningitis. There are some cases that we cannot prevent, like those that are due to viruses. We don't have vaccines. But if you take general precautions, avoid overcrowding, good hygiene, hand washing, taking children who are sick to the hospital on time so that the virus or bacteria does not get to spread down to the brain, most children will be fine. So I hope that is helpful for Christabel. Um, let's move on. Do you mind
Okay.
reading
Good evening, doctor. Is it normal for a 7 years old to start growing public hair?
pubic hair? Okay, yeah. So pubic hair is what we call puberty, and it's one of the signs of uh, puberty. All right. So puberty it varies, and the age at which children start to go into poverty is coming down lower and lower, and now it's as low as 8 for girls and maybe 9 for boys. You didn't tell us the age of this I mean the whether this is a boy or a girl. You really need to be very, very specific when you're asking those kind of questions. Always tell us is it a boy or is it a girl. So some children can develop their puberty earlier than normal, what we call early, puberty or early. I mean, like it is a little bit precocious, like something that happens a little bit early, but it may not mean anything. It just means that they're a little bit early and nothing else. But for some children, it may be a sign of some other problems, like some what we call endocrine problems. So for I would just say, because you didn't tell us the whether it's this a boy or a girl, whether there are other issues, it's best to just see a doctor first, preferably a pediatrician, preferably a pediatric endocrinologist, preferably in a teaching hospital. I keep saying that because there are doctors that can only handle some cases. Not every doctor is an expert in some field. And so you should see them and they examine the child, make sure there's no other issue, and we're sure it's just an isolated pubic hair. There's no other problem, and it is just the child just being a little bit early. There's nothing to do than just to reassure you. But sometimes we have to be sure there are no other issues. And because you cannot tell me all that right now, so I would rather just say see a pediatrician, preferably a pediatric endocrinologist in a teaching hospital, because they can do all the other examination and then they can say, okay, this is just um early puberty, or there's something else going on that we need to do something about. All right, I hope that's helpful. Good evening to all those who are greeting us. We greet you. Thank you so much for joining us. All right, let's go on. Uh, Semi Tokpa, you are on mute. Can you just unmute yourself?
Okay, sorry. Good evening, ma. My son wasn't given OPV1 and 2 because it's not available, but was given OPV3. Hope it won't affect him. That's
Okay,
from Feintola.
I get a lot of this kind of question. Now, I need for people to understand that when we say a vaccine is OPV1 or OPV2 or OPV3, they are not different vaccines, it's the same OPV, okay? So the 1 and 2 and 3 and 4 and 5, whatever we put in front of those vaccine, is just to let us know which number of that particular vaccine the child is taking. Okay, so it's just telling us that the child should have taken OPV1 at 6 weeks, OPV2 at 10 weeks, OPV3 at 14 weeks. It's still the same OPV, it's still the same oral polio vaccine. It's not different. In other words, there's no special one that is OPV3 and there's no special one that is OPV1, or there's no special one that is OPV2. They are all the same. All right. It's the numbers is just to let you know that those vaccines are not taken just once. So, for example, BCG, we only give it once. So we don't say BCG1, BCG2, BCG3. Just BCG is BCG because we only give it once. But when we put a number in front, like Mrs. 1, Mrs. 2, it is the same Mrs. vaccine. They are not special different. It is just that we're giving 2 of it. So we want to use the number to let you know when you say Mrs. 1, that means you've taken the first one, and then you're going to still go and take Mrs. 2. Okay. So if your baby is just giving OPV 3, that means your child has only taken only 1 dose of oral polio. So you need to still go back and collect all the other 3 that has been missing. But now we're actually gradually phasing out oral polio. We're replacing with injectable polio, the IPV. So you need to tell me whether your child has gotten the IPV, because some children now we give them IPV instead of the oral polio. We're still trying to give both of them together, but gradually we're going to completely remove the oral polio and everybody will only be taking the IPV. So if your child has taken IPV, then maybe it may not be something to worry about. If your child has taken IPV1 and IPV2, so taking OPV3 will not be an issue. But if your child has not taken the IPV and has only taken only 1 OPV, then you need to still go and collect the rest. So sometimes vaccines are not available. It doesn't really matter. The fact that your child has now taken all the one the child has mixed, the child can still take them again. So now that your child has taken OPV, so what your child has taken is actually OPV1. That's the first dose your child is taking. So you need to go back and take OPV2 in another 1 month. Then in another 1 month, you can go back and take OPV3. So all those vaccines that are 1, 2, 3, 1 and 2, even if you mix them early, you can always take them. The most important thing is that you put at least 1 month gap between each of those doses, like one, then after 1 month, you take the second one, and after another 1 month, you take the third one. You cannot take all of them the same day. You have to take them 1 month apart. But you can always go back to take any vaccine that your child has mixed. There are just a few exceptions like Rota and I guess Rota is about the major one, and then maybe hepatitis B1. So there are some vaccines that once you don't take them at a particular time, then that's the end of it. But majority of the other vaccines, you can always catch up. You can always still go back and take them because your child will still need them for as long as possible. So if you have not taken any of the IPV and your child has only taken one oral polio, you should go back and take the rest. And usually a good health center would have told you when to come back. They would have given you another date to come back to catch up on the one you have mixed. Okay. All right, Instagram people, I can't see any question. Please. Okay, no, there's a question. No, it's in the box. Sorry. Can I just take 2 questions from Instagram that will come back?
No problem, ma'am.
All right. So Huani, what's the fastest cure for cough? There's nothing like fastest cure for anything. All right. And there's nothing like cure for cough. Cough is actually not a problem. Cough is just something we all do. Cough is a reflex. It's something you do when there's something irritating your airway you're trying to. So everybody can cough. So the fact that you cough doesn't mean you have any problem. So cough is a problem if it is due to something else. And usually those kind of cough are continuous and irritating. And when the child begins to cough and you begin to count, like everybody can count, like who is coughing there. So if I just cough once, that's it. Most of you say bless you, and that's the end. But if you keep coughing, and everybody like is something going on. So and then the question is, what is causing the cough? What is causing the persistent cough? And that is what we now need to deal with. So some cough could be due to viral infections. You don't need to do anything about it. If a cough is due to with fever, fast breathing, maybe it's due to respiratory infection like pneumonia, then you need to do something about it. Cough can also be due to heart problem. There's so many things that can cause a child to cough. Somebody can be coughing because they are aspirating, like food is going the wrong way, or they've taken in wrong something else, like what we call foreign body. So the most important thing is to know what is causing a cough, especially if it is cough that is recurrent, and then that will now determine the treatment. So there's nothing like one magical drug that is the fastest cure for cough. That is just to clarify. So if your cough, if your 3-year-old has been coughing for a month, you need to go to the hospital. Okay, any cough that has lasted more than 2 weeks is classified as chronic cough. It is too long. So 2 weeks is the cutoff. If your child is coughing for 2 weeks, you need to go to the hospital because we now have to start looking at the causes of cough that will last for 2 weeks. Because most coughs that are due to viruses and all that, they usually last for a few days, maximum 2 weeks. So, and they go by themselves. If it's a viral infection, if it's a bacteria, the child may be having fever, fast breathing, you need to go to the hospital. But if the child is not coughing for a month, you need to go to the hospital because we have to look at other causes of what we call chronic cough. And I will now start looking at things like tuberculosis, things like asthma, things like maybe a heart problem, because those are the ones that tend to leave cough going on for long. So it is not something anybody is going to give a cure to. You have to get to the hospital. All right. I hope that's for the next question from Temi Hell. At what age can one start bathing a baby twice a day? You don't need to bath babies twice a day. They are not going out. They are not dirty. So they don't need all those extra baths. I don't know why baby need to have a bath twice a day. Once a day is fine. Okay. Babies are usually at home. So they are not going out into the dirty and getting dirty and having dust like adults. So they are indoors. And children babies have very what we call large surface area to their weight, so they can lose their heat very fast. So there's really no reason for us exposing them and bathing them all the time, because in that process you're exposing them, they're losing heat, and it's just unnecessary. Okay, once a day. In fact, people that live in countries where it is really cold, like those in UK and other colder climate kind of countries, they don't even bath their children every day. Maybe twice a week or twice a week is fine. So there's nothing you need to do, like you have to give a baby a bath all the time. No, it's not necessary. Make sure your child is not over covered, like they're sweating too much. Make sure there's lots of ventilation in the room where they are. If they poo or wee, you can wipe them, you can clean them, you can do all that. But they don't need that physical bath where you strip them completely off and start pouring water all over their body. They don't need it more than once a day. That's so just that. For a first time mom, for my first time mom, you should go get a copy of the FTM companion, because all these kind of questions have addressed them and why. You can also get the frequently asked question for first time moms as well. 500 questions of them, all these kind of questions properly answered. I'll recommend them for you. All right. Last question on Instagram before we go back to Facebook. Somebody show me for King. Good evening, dog. My baby of 16 months doesn't like eating family food. All she wants is cereals. I don't know what to do. There's nothing to do than to keep offering the food to the child and not just offer cereals all the time. And this usually dates back to when we start complementary feeding, because most mothers, when we start complementary feeding, the only thing we give to our children is cereal. So it's pap or one particular store cereal all the time. So right from 6 months, when we are offering food, we should be offering them variety of food, not just cereal. And I always say it over and over again, complementary feeding is not cereal feeding. People ask that question all the time, and it's as if cereal and complementary feeding are you can use them interchangeably. And I say no. So that is why it's so important for us to start early. But if you have started them on only cereal, that is all they eat all the time, then it is difficult now when they are older to stop them. So, but it's not too late. We can still do it. And there's nothing magical to do. It's just to make sure you offer the food. You keep offering them the food. When you offer them the right food, like a 16-month-old child, a 1-year-old child should eat the same meal as the rest of the family. They don't need to have their own special meal. They don't need to eat at special time. They should eat with the rest of the family. They can have snacks in between, but they should eat, and they should eat what you eat at the same time. So they note that that is what everybody is eating. So there's nothing special why I should not eat that. Initially, they may not eat as much quantity. I know it is easier to make cereal. Just pour them and pour water or milk, and that's it. So parents also like it. Whereas for other food, you need to cook it, you need to do that. But those are the sacrifice we have to make, and we have to be doing it persistently and patiently. Okay. So let them eat at the same time as you're eating. Even if it's only a small quantity they take, it's fine. Encourage them and let them eat. Sometimes you need to experiment with the same food and cook it in different versions. Some children may not like boiled plantain, they will prefer fried plantain. Some children will not like boiled egg, they will prefer fried egg. Doesn't matter. Some children, you have to break the egg into other food as, something. So just experiments. There are lots of websites and sites or groups devoted to all these babies, all these kind of recipes for food and all that you can try. So, but once you try, it's not just suddenly going to come on the child to start eating all those food. So you have to offer them, and you keep offering them. And actually, we say that when you offer food once, don't say, "Oh, the child didn't take it that once. That is the hand." If it's only one spoon the child takes, that's fine. Offer it again another time, then the child will maybe go on to 2 spoons or two bolus or swallow, whatever. Then you keep offering, and then they keep on increasing. Let's not just offer once and then they didn't take, okay, that doesn't like rice. Then you offer yam, doesn't make it. No, you have to offer over and over and over. Usually we'll say you have to offer like 13 times before you can even say the child doesn't like that particular food. And then make it fun, use colorful plates and all that. Just do all that. and model it. Let them see you eating, then they know that there's something wrong with eating this particular food. So that is how to get them to eat. So there is nothing magical that we're going to give you or recommend. That is what you need to do and keep doing until the child starts to eat. When the child goes to school or crutches or play group, make sure you don't pack cereal and biscuits and juice. Again, that's another thing we all do. We replace all this food with all these things for the children. Then why would they eat when they drank all the juice, all the biscuits and all that? Their tummy is full already. So you need to take out all the junk food as well. No replacement for food. They should eat normal food, and the snacks should be healthy snacks. Healthy snacks are fruits and all that. Since they can eat, they can hold a banana, they can eat a carrot, they can hold an egg, boiled egg, and all those kind of things. They can hold it in their hand and they can eat it. They don't even have to sit on the table to eat those ones. They can just eat those ones in between. So these are the things we can give them. You can make smoothies with your fruits and put some milk, and they can drink that one, and most children love it. So you just have to think and practice some of these principles. I know it's not always easy because all of us just want to give them something and they just finish it, but every child is not like that. We just have to do it patiently and keep offering it. But the longer you put it up, the longer it's going to take to get them in. So I see mothers, even in 3-year-old who are now in school, they're still going to school with bottle of, because they're going to take milk or cereal. Is wrong. The earlier we start getting them to do it, the better. So that's why when we start at 6 months, it's not just cereal we should be doing. We should be doing everything, so that when they are getting older, by the time they are 1 year, we want them to be eating everything your family is eating, and it is possible. I know it's a lot of sacrifice, but that is all we just have to do. Eventually, they will get there. And don't force feed them. And they don't have to finish the whole bowl you put in front of them. Even if it's just one spoon, it is fine. Just keep on encouraging them. Don't be, putting pressure, because the children can pick up on that, and they too will also now, like, you can't win against them when they decide they're not going to eat at all. But if you encourage them and you keep on, praising them when they do the right thing and keep offering it, after a while, then they get that. And then, of course, we keep an eye on the weight. Sometimes, as long as children are gaining good weight, we are not going to be worried. I know mothers always worry about children finishing whatever they put in front of them. It's not as important as long as the child is gaining weight and not losing weight. That means whatever quantity they are eating is enough for them, and that is what really matters. Okay, so I hope those are some of the tips I usually will give parents when it comes to all this eating, because it's a frequently asked question. So I hope that has helped. Okay, my moderator has disappeared. All right, let's go back to Facebook, then I'll come back to Instagram. I hope my moderator comes back. The next question from Facebook. Good evening. This question is not about my baby. Okay. It's about you. Does exclusive breastfeeding affect menstruation? Yes, it does. So usually when you are breastfeeding, you may not see your period. And I don't know about many mothers why you worry about that, because I personally like that, because you don't have to worry about bleeding. You don't have to worry about buying pads and all that. So that's actually one of the advantages of breastfeeding. So when you breastfeed, it's a form of what we call lactation amenorrhea. You actually may not see your period, you may not ovulate, and which is a form of family planning for you. So it's not 100% though, because before some of you will now say, okay, I won't do family planning, I'll go and breastfeed. It's good to breastfeed, but it is not 100% effect. It's not, I think it's about 90% or 90. So we say you should still do additional family planning, but that is what can happen. So if you are breastfeeding and you're not seeing your period, it's nothing to worry about, and you don't have to start fretting over whether you're pregnant or not. So as long as you're breastfeeding, and for as long as you're breastfeeding, you may not see your period. Some people will be breastfeeding and will see their period. Especially those who don't breastfeed exclusively, it is also normal. So you don't start to panic that I'm seeing my period. It varies from one lady to another, but majority of women who practice exclusive breastfeeding may not see their period throughout the period they are breastfeeding, and it is absolutely normal, and it is nothing to worry about. All right. Let's move on to the next question. Gifted, say good evening. What can cause infection in the brain? I've already answered that question. So if you are just coming, the same thing I said about meningitis is the same answer. It's the same infection that can affect the covering of the brain. It can affect the brain itself, and it can usually go through the blood. So once the infection enters the bloodstream of the child, it can go on, or if it enters through any of what we call the structures that are adjacent to the brain, like the eyes, the nose, all the structure around the face, and all that, they are very close to the brain. So any infection around what we call the dangerous area of the face, they can actually go straight to the brain and all that. So that is what can cause that. So uh,
Sorry, ma'am, my network.
yeah, no worries. So maybe say something. Okay, I'm lost at your part two. What can cause infection in the brain? We answer that and make the cells not to absorb it but gather in the brain. Okay, so the you are mistaken about CSF. CSF does not prevent infection from getting to the brain. Okay, the CSF is just the water that surrounds the brain. All right, and there are blood vessels in the brain. And so, if there are blood vessels in the brain and there's bacteria, virus, whatever in the blood, when they get to the brain, they can actually penetrate into the brain and they can cause infection. And yeah, so if a child has meningitis or any infection in the brain, it's a very serious infection. The child needs to go to the hospital and then the child needs to be treated with antibiotics. Some meningitis or encephalitis infection in the brain can become complicated, which is what you are trying to say. It can become complicated with, we have what we call the early complication, we have what we call late complication. So you are talking about seizures, you're talking about hydrocephalus. They can cause block in the brain where the water that surrounds the brain is not able to flow out and the head gets bigger. All those are complications, and that is why it's best to prevent it, which is the first question I answered today. Prevention, prevention, prevention. But once it's happened, it's very difficult. Number one, we can actually lose the child. Meningitis is one of the conditions that can kill children, or the child can survive, but we can have a lot of complications to deal with. So the child has to be managed extremely aggressively. So if a child is having fever, complaining of neck pain, headaches, and they are becoming like drowsy or they are becoming unconscious, that is an emergency. That is a child that needs to go to the hospital immediately. That's a child that has, this is not a child you'll be treating for malaria or malaria typhoid like most Nigerians are always doing. That's the child that needs to go into the emergency room and get into antibiotics treatment as quickly as possible. More importantly, let's ensure that our children take all the immunizations. Most of the severe kind of meningitis we're talking about, the organisms that cause them, we have vaccines. We have vaccines for pneumococcal bacteria. We have vaccine for meningococcal bacteria. We have vaccine for Haemophilus influenza. Those three bacteria, they are the most terrible of all. And we have vaccines. So if your children are vaccinated, then they will be protected against this infection. And please keep your children away from overcrowded places and all that. So those are the things we can do. All right, let's move on to the next question on Facebook. Okay, do you mind reading now?
Yes, ma'am. Good evening, ma. Good evening, ma. Please, what could be the cause of constant hotness and cough? My daughter is 2 years, 7 months.
Okay, what do you mean by constant? So I always prefer you are very specific with your with
Questions.
some qualifying words. So always tell us what you mean by constant. The child is having fever for 1 day, 2 days, 3 days. Is it throughout the day? That gives us a more that
Always
is more
put your questions
specific.
straight.
Yeah,
Yes.
that's more specific and easier to deal with than constant, because right now I don't know what you really meant by cause. Anyway, if your child is having fever and cough, you need to take the child to the hospital. It could be infection, it could be chest infection, pneumonia, those are, especially if the child is having fast breathing, difficulty with breathing, you need to take the child to the hospital. And the reason why I'm asking whether it's constant, what you meant by constant, is this something that happened and disappear and come back, or how long has this been going on? Because that will also help us to know the kind of severity or the kind of things we should worry about. So it's more important to say my child has been having fever for 3 days, all through the day, and this is how high the fever has been, and all that, and seeing constant, because that will not give us the right uh, information that will help us. All right, but this child needs to go to the hospital. That's just what I would say. All right, let's go on.
Doctor, my question is on my 8 weeks baby. Whenever I breastfeed him, he used to find it difficult to digest milk. Sometimes he cry before he belch. What can I do, ma?
I don't know how you know that the child is not digesting milk. There's nothing you said now that means the child is not digesting milk. So the fact that the child cried does not mean the child is not digesting milk.
Of
So
course.
you didn't enter into the child's
I'm
tummy.
worried.
So there's no way you can tell me the child is not digesting milk. Okay. So children can have colic. Children sometimes when they suck, they take in a lot of gas, and that gas has to come out either through the mouth or through the anus. And when the gas is moving around, it makes them feel uncomfortable. And that's why you see that when eventually they belch or when they pass the flatulence, they feel uh, more relieved. So those are normal things. There's nothing absolutely wrong, and it does not mean the child is not digesting any milk. So there's nothing for you to do. Just leave the baby alone. And if your baby is crying constantly, that is most likely colic. And what you need to do with colic is one of those things that are going to come to pass. In other words, they run the course and stop. And most of them, by the time they're about 3 months, over 3 months, colic would have gone. So all you need to do is to make the child comfortable. So some children, they get comfortable by swinging them around. Some, if you take them for a drive, some of them, if you rub the back, just do what some children like white noises. Do what work for your child. There is really no particular drug. I know some of you give things like Infacol. Sometimes it works, sometimes it doesn't work. So, but the good news is that most children have colic, and the good news is that by the time they're about 3 months and above, colic would have gone, and it's just a passing phase. So there's nothing to worry about. Okay, let's move
Okay.
on.
Good evening, doctor. My daughter will be 6 weeks tomorrow.
Mm,
Her legs used to shake, jilter, sometimes, especially if she wants to stretch. She stretches a lot. Also, she throws out milk most often after
mm,
breastfeeding, especially if she wants to belch. What do
mm.
you have to say? Do I need to worry? She's on exclusive breastfeeding.
Okay, what I have to say is that you don't need to worry because what you described to me sound like normal. Okay, which is very similar to the last question we just answered. All right, so babies can have reflux. So when babies suck, I've explained that several times on this platform. This gap between the mouth and the stomach is very short. The stomach itself is small, and all the food is liquid, which can easily flow back. So it is it is easy for the milk to come out, and that is why they have a little bit of milk coming back from the mouth and sometimes even from the nose, and that's what we call reflux. So what we normally do to reduce it, not to completely eliminate it, to reduce it, try and keep your baby upright for like 15 to 30 minutes after breastfeeding them. So that's you are using the law of gravity to kind of keep them upright. Because if you most parents, what they do is that when you finish breastfeeding, because your baby tend to sleep off after sucking, then you just say thank God, you go and put the baby flat down because they finish sucking. Then all the milk is just trying to come back, and that's when they tend to have a lot of reflux. So when your baby has finished sucking, don't put them down straight away. Keep them on your shoulder. Just rub their back. That will help them so that the milk can kind of settle, and then some little bit of digestion starts to happen. So the milk is at least a little bit curdled, so it is not so liquid to flow back. Though a little bit can still come out, and that's why some still bring out that small curdled kind of milk, but it won't be as much like if it happens immediately. So that is perfectly normal for babies to happen to for it to happen in babies. It's called reflux. So then when you talk about your baby stretching and all that, it's difficult for us to understand what you're saying. So babies move, and I don't know why mothers sometimes expect that babies should be like statues. Even you as an adult, you are not statues. So as I'm talking, I'll be moving my hands, I'll be moving my legs. So there's nothing wrong for your baby to move their hands and move their legs when they are after sucking, when they are sleeping and all that. It is only if a child is having what we call abnormal movements, like they have like what we call like a sudden kind of movement, like checking, and you will see that it will suddenly start and it will suddenly stop. And sometimes the children will cry out, and sometimes their eyes will roll up. That is what we call a convulsion or a seizure. That is what is worrying us, okay? And that is the one that we want you to do something about. But the fact that your child just move their hands there, move their legs here, it is not something to worry about. So, because most of the time, mothers are not, I'm not sure what you're referring to, because you use all the words stretch, and I'm still wondering whether you're referring to something normal or something abnormal. So it is better if you take a video recording of these movements and show your doctor, or ask your doctor when you are in the hospital for any other thing else, like maybe since you're going to go for your immunization. That's an opportunity to ask your doctor or your nurses or your midwives or whoever you are seeing, and then you can show them, then go, oh, this is normal or this is not. So most of the time it is nothing, to worry about. And like I said, for first time mothers, because you tend to ask these questions a lot, which I don't blame you, because this is your first time, so you don't know everything which is normal, everything which is abnormal. You may want to get the FTM companion, the FTM frequently asked questions, so that you know how to recognize what is normal and what is not normal. But my gut feeling is that most of what you're describing is perfectly normal. Okay. All right. I'm going to go to Instagram and take the next question on Instagram by Damilites. And please, one of my twin boy does not like to eat the other. Does not like to eat. Okay. The other one is 5.3, the other is 6.2. They are 2 month plus. They are not on exclusive, but I give them more breast milk than the baby food. Okay, you didn't tell us what is the weight of your babies, when they were born. Were they born preterm? Were they born on time? So if your baby is already weighing 6.2 and 5.3 at 2 months, I'm not worried about their weights. And I worry whether you are actually overfeeding them, because you are not doing exclusive breastfeeding. You didn't tell us what their birth weight is. For example, an average baby is born 3 kilos. So if they're already weighing 6.2 at just 2 months, they're supposed to double their birth weight at 6 months, not at 2 months. So please don't overfeed babies because you want them to be big. Too big babies is also a problem as well. So we want children to have healthy weights and not be overweight. So children who are already weighing 5.3 at 2 months and you're saying they are not eating, they are eating more than enough, because the most objective way to know whether a child is getting enough food is not by what you report to us, because I don't know how much you're giving them. It is according to their weight gain. That is what the doctors uses. That's what we as pediatrician were using. All right. Unless you're telling me your baby they were 4 kilos at birth or something, but I am never going to be worried about a 2 month old baby who is already weighing 6 kilos. That is a lot. All right. Most babies weigh 6 kilos at 6 months, not at 2 months. So watch what you're giving them. So if your child, because most of if you are breastfeeding, see that's the challenge with meat feeding. You are breastfeeding, and when you are breastfeeding, you cannot quantify how much your babies are sucking. You don't know how much is going into them. And then you're giving them formula. Most of the time, you're also giving them formula like as if they are only on formula. You won't know that you're giving them too much of food. So that is very important that you need to check. What we recommend is that you breastfeed exclusively. I know some of you will say, well, I can't do that. But you need to be very careful that you also don't overfeed them. Okay. And it's not all the time that babies are taking the food that they actually need the food. Okay. So it's important to know the best weight, then we can work out what the weight should actually be now at 2 months, and then we can work out what quantity should they be taking. All right. So obviously, I don't know why you say the child is not eating well, but I am worried that these children are actually eating more than enough, because they are already weighing more than what you have expected for an average 2 month old. So you may want to provide those details and I can give you more information. Okay, yeah, you say your 2 years, 6 months old is 10 kilos this year alone. I can count how many times I've treated her for infection. It is draining. So if you are going to hospital and treating your child, you need to ask the doctors what is the diagnosis, what is wrong with my child. So I hope you're not the one treating the child. Like, I hope you're going to the hospital, because that's another thing. Please don't self-medicate children. If your child is having any fever or any illness, please take them to the hospital and let the doctors be the one to evaluate the children and treat the child. Okay, if your child, and when you go to the hospital, it's important to ask what is wrong, because you need to know what is the diagnosis, and that will help you to know how do I prevent this from happening? So it is not normal for a child to be having infection or malaria all the time. It is not normal. So if they're having it so many times, you didn't tell us, you need to ask your doctors. And then this is you doctors to now tell you this is what we think, and then for them to figure out why. For example, if your child is going to crutch, maybe the child is getting exposed to other children who are having infection. It may just be as simple as keeping the child at home and not taking the child to crutch, because that's a way for children to get infection over and over again, depending on what infection. For example, respiratory infection is common in children who are going to crutch. As they're getting better, they go back, they get it again, and so it becomes a vicious circle. So, but these are the kind of conversation you need to have with your pediatrician, so that you know what is going on. And some children may have some immune problem. That may be the first sign that there's something wrong somewhere. If a child is coming in and out of hospital with infections, we need to know, is there something going on with the immune system here? Is there something we need to deal with? So that is why it's so important that we don't just keep treating the child. We need to know what is going on. And if you are not seeing a pediatrician, this may be the time for you to see a pediatrician, so that they can do further evaluation, they can know what is going on, and they can advise you appropriately. All right, so that's what I'm going um, to say. So you need to have that conversation first with your doctor. Don't make assumption that it's coming from school, because I don't have all the information. I don't know which infection your child is having, number one, and that will help us to know whether it's something that can come from school or not out from school and all that. So, and like I said, 2 years, 6 months, they can stay home. They don't really need to go to school. School age is actually from 5, 6 years. So if you think your child is getting infection, either you change the school or get another place. But first, ask that conversation with a pediatrician before you start jumping to conclusion. All right. Okay, exactly. So your twin, one is 2.8, one is 2.26. I think 2.6 or 2.6. Okay, 2.6. So your both twins, let's even assume your smallest twin is a 2.6 and it's now weighing 5.2. Those babies have doubled their weight at 2 months. That is too much. That doubling of weight should happen at 6 months. All right. So that's what I was telling you, that, and you are worried that these babies are not eating enough. These babies are overeating. That is what it means. So that is why I'm telling you that we don't rely on what information mothers give. Your information is not as objective as the weight of the child. The weight of the child tells me this is what is going into this child. So this child is 2 months old and they've doubled their birth weights. So that means they're getting more than enough. So I'm not going to even recommend any increase. And children know how to take what they need, and then they will stop. So if you don't force them to take more than what they need, they won't take more than what they need. So just let the baby be. And if possible, try and breastfeed them only. Okay. You may not know that you're giving too much, but you are, because they are gaining too much weight. And can imagine what they're going to be. They are going to get to 10 kilos at 1 year. And we are just 2 months and we're already at 6 kilos. That is a lot. So you can work out that mass. So I think you should actually take down the feeding. And I think for twins, you need to be very careful, because it's very easy for you to not be sure which one you fed, which one you're fed, and you're double feeding them because actually if they look alike. So you need to be very conscious of that as well. And if you need help, get help to make sure you are not doing that. But I'm not going to worry. I'm not even going to say you increase the feed. I'm actually going to say you need to keep an eye on the quantity that is going into them. So for them to be weighing like 5 kilos or 6 kilos, they shouldn't be taking more than 500 mils of milk in total for the whole day. And that includes both the breast milk and formula and everything that goes into them. So you need to watch. So what quantity of formula are you giving? How many times are you giving? Those are the questions you need to work out. They shouldn't be taking all in total more than 500 mils. For the one that is weighing 5 kilos and one that's weighing 6 kilos should not be taking more than in total 600 mils, all for the 24-hour period. So you need to work it out. And it's very easy, like I said, because you are breastfeeding, you don't know how much they're already taking from your breast. And so you should not give them formula like if that's the only food they're also taking, because that's double feeding them and it's not good for them at all. All right, let's go back to Facebook. Um, welcome back. Uh, welcome back.
Yes, ma'am.
Okay, this is just
Okay. Good evening, ma. I'm so happy to be part of this live training. So happy. Thanks, and God continue to bless you. Amen. And you too.
amen. Thank you.
Well, I'll be going for 6 weeks immunization tomorrow. I need to give any drug after immunization. Can I bat at two afterward? Thank you, ma.
Okay, so going for immunization, you don't need to give any drugs before immunization. Don't give anything, okay? After the immunization, because most children with pensa, that's the one we give at 6 weeks, tend to have fever. You can do it two ways. Usually, I would just say wait until the child has fever, and then you can give them paracetamol. You can just be conscious of them. You can give your baby a bath, normal bath. In other words, if you are given a bath in the morning before the child goes to the hospital, you don't need to bath the baby afterwards. Okay. The next bath is the following day, all right? The normal time you bath the baby. So there's no special bath after immunization. But be very gentle with the legs, because they're going to get two injections on both thighs. So when you are handling them, be very gentle. Some of you just carry the baby holding them, and you are not very sensitive to the fact that this child has just had very deep intramuscular injections on those thighs, and they are very painful. So be very gentle with the legs. You can apply ice packs. So the ice pack is just get like a face towel or like handkerchief, those ice blocks, like the cubes. Just put like three or four in a handkerchief and tie it, and just put it gently on the thigh, just gently. Please don't rub, don't massage, don't do anything. Just put the ice cubes on the thigh, like for like maybe less than 1 minute, maybe a few seconds, and you stop. And then you apply it again, maybe another 2, 3 minutes. There's no special thing. Just do it gently, intermittently. The idea is so that it doesn't make the place to swell. And usually you do that for the next few days, they'll be fine. So if they're having fever, having pain, you can give them paracetamol. Please, if you don't know the dose of the paracetamol you need to give when you go to the hospital tomorrow for the immunization, ask the doctors. Most of you already bought uh, this paracetamol drops. Okay, now the dose of the paracetamol drops is different from the dose of the paracetamol syrup. Okay,
Pardon my network,
and
please, ma.
it's okay, no problem. So you need to know that the doses are different. So when you go to the hospital tomorrow, they're going to weigh your baby. So when you weigh your baby, ask them if my baby has fever. Actually, they should have told you all this information, because I'm always curious why we don't. I did those are the information they give, but I know some of the mothers, you don't go early to the immunization clinic. You are going there and you are gisting. So most time the nurses or the healthcare providers, they always do a talk before the immunization process, and they always talk you through what to do with the side effects of the immunization. So make sure you go early, make sure you listen to that talk, and make sure you get the dose of the paracetamol you need to give your baby, because most people will come to ACP and ask, maybe it's what how much should I give? So the best people to ask is in the hospital, because they know the weight of your baby, and then they can work it out for you. All right. So make sure that you get that information. But like I said, fever, pain, give paracetamol. The legs, apply ice packs intermittently. You can give paracetamol every 6 hours for the next 2 to 3 days, and it will be fine. Okay. If your child is having convulsions or any other issues, please, you have to go back. It's a very rare thing. Most children will be fine. They don't have all those things. But once in a while, we have a child that can have what we call idiosyncratic reaction, like a reaction we are not expecting to the vaccine. Those are the ones that you need to go back to the hospital. So, but otherwise, most babies, paracetamol, ice packs, they'll be fine. The place where they give them the injection may feel hard. It may look swollen. It may look a little bit red. Don't rub it. Don't apply anything. Don't apply kerosene. Don't apply toothpaste. Don't apply all those things. Just leave it alone. Only apply ice packs. It will go down. It is a bleeding that occurs under the muscle because of the injection. But if you rub it, then you're going to make it swell. You're going to make it bleed more. So if you just leave it alone, the bleeding will become coagulated. That is why it feels hard. And after a while, the body will resolve it, will reabsorb it, and that's that. So you don't need to do anything beyond that. I hope that's helpful. I don't know. My Semi keeps appearing and disappearing. Somebody says giving IPV and okay, IPV. How many was your baby given? So when you go back to the when you are if you are home now, go get your immunization card out. Look at all the immunization your baby has taken. Usually the nurses will sign in front of the one your child has taken. So there's IPV1, there's IPV2. You need to check all that. So if your child has, so it is not just to say your child has taken IPV, it is to make sure your child has taken the right doses. And go whenever you go for immunization and you are not sure what your child should have taken or your child, you should ask. Please always ask questions in the hospital. Ask your healthcare professionals, ask them at the health center. My baby didn't take OPV1 and OPV2, and you have given OPV3 today. Maybe they sign in front of OPV3. You need to ask them what is the plan for OPV1 so that they can give you that information. And if they, so you must always ask. Please don't be scared of us. Don't be scared of health professionals. You have a right to know. You have a right to ask questions. Please ask questions before anyone gives your child any immunization. I can't remember how many times people will come back to ATP and say, oh, they gave my child the wrong vaccine, they did this. And I'm like, before they give your child, well, you're not there. You were there. Nobody just grab your baby and give you anything. You were there. So you have a right to ask, what are you going to give? Human beings, doctors and nurses, we are human beings. We can make errors. Errors can happen. But you as parents can help us reduce that error by asking this question. I know most of you are going to say, oh, they're going to scream on me, they're going to shout on me. Nobody, you may be surprised, nobody's going to scream or shout on you. Don't because of those assumptions, or ask. Ask. It's your right as a patient to ask these questions and to do the right thing. All right. So I hope that's helpful for you. Let's move on. Shemilore. So the next question is, my baby was to take rota last week, but not available. Where to come back this Wednesday. Hope there's no issue. There's no issue. Just go and get it. I know there's a time frame for rota, but you didn't also tell us the age of your baby. How are we going to tell you the time frame? Always tell us the age of your baby in every question. All right, the next question. Okay. Hi, Yoba. Say good evening, ma. My son is on exclusive breastfeeding. It's exact 6 months. I'm going to stop EBF. Yes. When your baby is exactly 6 months old, you can start complementary feeding. So if your baby 6 months today, you start complementary feeding today. Okay. You understand? Because remember that when your baby was born, it's 0 day. So when we say breastfeeding for 6 months, that 6 months actually ends on the day your baby turns 6 months, because 0 to 1 month is 1 month already. 1 month to 2 months is 2 months. I know it's a little bit confusing because some people will wonder whether it's going to be at the end of 6 months. No, it is on the day your baby turns 6 months that you have completed 6 months of exclusive breastfeeding. So keep breastfeeding, but you now start adding the complementary feeds. And to know how to go about complementary feeding, please go to our Facebook group. We have a guide session. There's guide 2 on complementary feeding. I strongly recommend that you go to that Facebook group first, watch all the videos, because people always start doing complementary feeding wrong, and then we start dealing with the issues afterwards. So to avoid that, it's better to have the knowledge. What do I give? How often do I give it? What quantity do I give? All those information, very lovely videos made in a way, using everyday mothers, using everyday food, not something you buy in the store. and you will understand how to go about complementary feeding. It's better you watch those videos, or you can also watch those videos on Global Health Media. They are the ones that made all those videos. Very important for you to go through them, and then you understand complementary. There's no urgency in starting complementary feeding. Understand the information first, and then you start. If you're on our Facebook page, we also have it on our Facebook page. Just go to the video section of that page, and then you can see all those videos on complementary feeding. About 6, 7 of them, very lovely. Watch them, and you'll be good to go. All right, the next question, Honwogu Kelechi. Good evening. My son of 20 days has a little bleeding from his belly button. Its umbilical cord has healed. And after some days, started bleeding, doesn't feel pain, have clean methylated spirit, but for a week now, the blood still come out. So what your child is having is what we call vitamin K deficiency bleeding or associated bleeding. We used to call it hemorrhagic disease of the newborn. So the question I need to ask you, was your child given vitamin K at birth? So all newborn babies will be given injection vitamin K. Some of you go to hospitals that are not very they don't do all these things. Let me put it that way. So you need to go back and ask them, was my baby given vitamin K injection when my baby was born? Your baby that was not given vitamin K, you need to go back and get that vitamin K, because babies don't have vitamin K, and we need vitamin K for clotting of blood. So when there's no vitamin K and it was not given at birth, that child could be prone to bleeding, and they can bleed from the cord, they can bleed in the urine, they can even bleed in the brain. It can be that bad. So we always want all babies to have vitamin K. And if your child is bleeding, you need to take the child to the hospital. They can still give the vitamin K, and then we need to check that the baby has not bled too much, that the PCV is okay, and it will stop. It will stop. But the most important thing is to make sure that the child has vitamin K injection. So Onwogu, you need to take your baby to see a pediatrician, or go back to the hospital where your baby was born, ask them whether your baby got vitamin K injection, and then they can give the vitamin K. Okay, yeah, your baby will be 6 months by January, so you can start complementary feeding on January. Whichever day in January your baby starts. So you still have the whole of December to prepare. So go watch the videos and prepare yourself. Meanwhile, keep breastfeeding. And please remember that when you start complementary feeding, you are not stopping breastfeeding, because a lot of mothers get it mixed up. Complementary feeding means you keep breastfeeding, but you are adding other food. And even when you start at 6 months, breast milk is still going to be the child's main food. Breast milk is still going to be the child's main food for 6 months. So there's no hurry in getting them to eat at 6 months. That's why I always worry when people start getting frustrated at 6 months, because when you start at 6 months, you see breast milk that is 80% of the food. Complementary feeding is just twice a day, and usually a little quantity. If it's just 1 spoon the child takes, it's fine. If it's 3 spoons, it's fine, because at that point we are only introducing new food. And when you start new food, you start slowly and gradually. Don't aim for them to finish a whole bowl of pap or something. No, even if it's 3 or 4 spoons, it's fine, because you keep on breastfeeding, and then you gradually increase the quantity, the texture, and all that. That is all this information is in our complementary feeding videos. That's why we always recommend that we watch them first. All right, our time is up. I'll just quickly answer the left over questions we've had, and then we can call it a day. All right, somebody say thank you for all you do on this platform. My 8-week-old baby has covered and kata for almost a week. Be covering him up and up, but his nostrils are always blocked, and it's affecting his breathing. Okay, so if your child has cover and kata and the nose are blocked with what? With mucus, or you just assume the nose is blocked because of the noise? So if there's like mucus plug, like catarrh plug blocking the nose, you can apply what we call normal saline drops. Normal saline is just salt and water mixed together. There's nothing magical or fantastic about the idea. Is that it helps to soften the mucus so that the catarrh can flow out, and the children can breathe better, because children breathe through their nose, and their noses are very small. So any little thing that blocks that nose, they're going to struggle with their breathing. So if you just apply saline drops, you can get it in pharmacy. You don't need a prescription for that. Just say that you need saline drop. Don't go and take Otravine from them, because a lot of people in our pharmacies, sorry to say, in Nigeria, they are not even pharmacists, they are not even doctors, they are just salespeople. So sometimes you just say you want nasal drop and they don't have the nasal saline nasal drop, they're just going to get Otravine for you, which is not right for a baby. So please don't just take any nasal drop. Check, you can read. That's why you can read. That's why it's important as a mother to have education so that you can read. It has to be normal saline drops. Normal saline drops. If they don't have it, that's fine. You can ask them to give you the normal saline drip, because it's the same thing that is in both of them. It's just that you don't need something that big. But if they don't have the drops, you can get them to give you the normal saline drip, the one that we normally give, like when you go to hospital, like a drip that will normally hang up. So when you puncture, you can still use that one. The only thing is that you have to cover it up, because well, then it's so big, so you're going to throw away most of it anyway. But if you can get the saline drops itself, that is the best, because it's a small one and you can just drop it in the nose once every 3 times a day or something. It will soften the mucus. It is not the treatment for the cough or the cold. It is just to make the nose to be free. And most cough and catarrh in babies will resolve on their own. You don't need any treatment. Most of them are due to viruses. The most important is to keep baby away from people who are coughing. All those people coming to greet baby, they don't need to greet baby. I know I always say this all the time, but the people that are coming, they need to greet you and not the baby. So please don't take the baby to greet the visitors. Keep the baby inside the house, inside the room, with maybe your, and whoever is your helper. You can go and greet your visitors, because these are the people bringing all this cough and catarrh to the baby, and the siblings too who have gone to school. Those are the people bringing the cough and the catarrh to the baby. So you need to make sure you keep baby away from them. All right, wash your hands and all that, and make sure you breastfeed your baby exclusively. Exclusive breastfeeding provide the baby with antibodies and agents that fight infection. This is why we always say exclusive breastfeeding. A lot of mothers fight us for that, but it's not about food. It's not about baby eating. It's about prevention of infection, and that is it. So that is one of the reasons we want you to exclusive breastfeed, to keep your baby away from all this infection, all this fleeting in the house, all this cooking, all this smoke, generator fumes. Keep them away from. But these are things that irritates the baby's airway, that makes them have all this cough and catarrh. So you need to not only focus on putting in saline drop and letting the thing to clear, but you have to prevent them from happening. So that's why I've taken time to explain the preventive methods for you. And if you do that, your baby will be fine. And then just breastfeed, keep baby warm and all that. No water, breast milk only, no water. All right. The cough comes. I don't know this person. Okay. I guess this person that asked earlier about baby whose cough comes and after taking antibiotics, he stay away for 2 weeks. Okay, that person asking about constant fever and cough. I assume yes. All right. So your baby this is not constant. So this is what we call recurrence. So your child has cough and fever. You go for antibiotics. The child gets better, and it comes up again. So the question is, why is it coming again? We need to work out that. So is this that the child is getting infected again? Is your child going to crash? Or does your child have some things in the airway? So like for children, for example, that have adenoid enlargements and all that, they tend to have recurrent respiratory tract infections, or so we need to know all that. So whether your child is actually having something like asthma and all that, because people just treat it like antibiotics, which is not necessarily correct. So if your child is having recurrent respiratory infections, please see a pediatrician. And when you go to see a pediatrician, please don't just take another course of antibiotics. The question you need for them to answer is, why is my child always having cough and fever every 2 weeks? That is the most important question to answer. They will ask you lots of questions, examine your child. Sometimes we may need to do a chest x-ray. We need to arrive at the answer, and then we can help you to prevent it from happening again. But if you just keep giving antibiotics and not answering why, then you keep on coming back again and again, which is not good for the baby. So it's important to ask those questions. So if you have seen a general doctor, you may want to see a pediatrician this time around, because they can ask those questions, examine the child, sometimes do an x-ray and all that, and then explain why, and then we can get to the roots of it. All right, I hope that's helpful. All right, time is up. We have to go now. Um, um, Somebody's asking, does seizure really go forever? Yes, it can go. If your child is 5 years old, they are studying for a year now, yes, but your child has to be treated properly. So if your child is having convulsions, seizures, you need to make sure your child is under a pediatrician or a pediatric neurologist. Your child has to be taking the medication properly. The dose may need to be adjusted and all that. Some of you, you go to the hospital, they give you the medication and you don't go back. No, you have to keep going back. Usually we'll see you every 3 months, and after we are sure that the child is not having the convulsions again, you still need to keep taking the drugs for at least another 2 years. After 2 years, if the child is not having the seizures again, we can now gradually stop the medication. So you need to make sure you are going. If you go to our Facebook group, if you put your questions there, we can give you the booklets on how to handle epilepsy, which is what we call conversion that is required. It's not anything magical. Well, I know a lot of people don't like to hear the word epilepsy, or we can call it seizure disorder, but it just means a child who is having seizures over and over again. That's why there's nothing stigmatizing, or there's nothing theory about it. I know most people don't like that word, but it's easier to use that word than to just say seizures, because a child can have seizure and that is once off. A child can have seizure with fever, that's once off. But a child who is having seizures without fever and happening over and over again, we call it epilepsy. And that's what help us to be able to handle it properly. All right, the next question. 3 months having cough and catarrh. I think I've answered this question. Don't give your child cough syrup. Don't give tutolin drops, whatever. Don't do that. So I've told you what to do with cough and catarrh. Prevention. If the child is having blocked nose, normal saline drops. If the child is having fever, fast breathing, difficulty with breathing, hospital, because that would need antibiotics. All right. But no cough syrup. Please do not give cough syrup to children at all. At least children below the age of 1 year. I will stretch it to 2 years. Just don't give them cough syrup. My child nose is closed one side, the other is really open. Your child's nose is closed and your child is already 1 year, 7 months. Have you seen a doctor about this before? So if your child nose is blocked, we should have discovered that's when your baby was born, and we should have done something about it. So I'm surprised nothing has been done. So if you are really sure your child's nose is closed, you need to go and see the ENT doctors. If you are really sure something is blocking the nose and it's not open at all, you need to see the ENT doctors. They have to do an operation and open it up. All right. Okay. Ayobami, my son is okay. I think you've answered this question already, and we've answered them. No, don't start complementary feeding at 5 months. Complementary feeding is 6 months. There is no advantage of doing all these things early. All right. I don't know why we're always in a hurry. There is no extra advantage. Honestly, there is none. When we make recommendation and say do this at this age, trust me, those recommendations are not made because people just like to stress you, or we just like to make those recommendations. There are researches that go into all those kind of recommendations. There are lots of researches that people have done. There are comparisons people have made. People have done research, which we were not going to bore you with as parents. We would just want to tell you the outcome, and we have said that the best time to introduce complementary feeding to babies is at 6 months. That is when the intestine and the stomach, what we call the digestive system, that is when it is most ready to handle solids, not before. So there's no this, and these are recommendations not made for Nigerians or Africans alone. These are recommendations for the entire world. This is World Health Organization based, WHO based, UK, AAP, NHS. These are the same recommendations. So don't think, oh, maybe it's because those of us that are in Nigeria. No. Solid should be introduced at 6 months. When I talk here, I'm a scientist. I'm not just like, any other person. So we scientists, we talk based on what we call evidence. There must be evidence backing any recommendation you make. You don't just say, okay, I think I like 6 months. Okay, why not do 5 months? Somebody must have done it. People have done researches to say, why is 5 months not better than 6 months? Why is 4 months? And that is how they come to these recommendations. So researchers are backing them up. So we call it evidence-based. So we have evidence to say the best time to introduce your food to your complementary feeding to your babies is 6 months, and that is what we want you to do. Don't do it earlier, don't do it later. All right, so tell mother-in-law, show her the video. This video is so going to be available after this program on Instagram, on Facebook, on YouTube. You can show her this video and tell her that Dr. Gbemi said it should be 6 months. Keep on breastfeeding till 6 months. Okay, so tell her not to press any food into the baby's mouth. And when it comes to mother-in-laws and mothers and grandmothers, please, we only know one mother, okay? When it comes to babies, you only know one mother, and that is the mother of the baby. All right. Every other person, you have to be firm but respectfully decline. Just send it by saying that's not what my doctor said. My doctor said I should not do it. End of story. Don't be rude, don't fight, but be firm. All right, because it is your baby. And I say this with all sense of responsibility. We see a lot of things, okay? We pediatrician, we see a lot of things, and it's always painful because if anything goes wrong with your baby, trust me, all you are going to get from everybody else is just that sorry. Nobody is going to feel that pain. Nobody went through labor. Nobody went through 9 months pregnancy like you. So nobody has the right to dictate what you should do with your baby to you. Trust me. Tell your mother-in-law has given birth to her own son and she has raised her own son for you. You have to raise your own baby, and nobody should force you to do anything. Actually, when it comes to health issues, when it comes to all those okay, should we wear yellow, wear white, all those things, you can let them have their way. Those things doesn't matter. But when it comes to health issues, when it comes to things going through the mouth of your baby, please be firm and stand your ground. I will never forget a child that we lost, and the mother-in-law gave kerosene to the baby. She wants to give water to the baby, and it is all this thing: don't give water, exclusive breastfeeding, but we must give water, we must give water. At the end of the day, end up giving kerosene to the baby. That baby died. Now, what is going to happen to that mother? Of course, it's all going to end with sorry. Of course, everybody is going to feel bad, but the baby is gone, and it is the mother that carries that 9 months and knows that she has wasted 9 months of labor. So please, when it comes to your baby, be firm. Okay, I'm a pediatrician and I see slug it out with my mom when I was having my babies as well, and I was like, no, it's okay, no, it's no, this is me, this is my baby. Of course, things that don't matter, we let them do their own. If they want to carry baby, if they want to back baby, let them back baby. It doesn't matter. But when it comes to food, drugs, things going through the mouth of your baby, please, you have a right to stand and say, I don't want it. This is my baby. This is what I want. This is what the pediatrician say I should do, and that's what I'm going to do. End of story. And you don't have to feel bad. Don't worry, if they call family meeting, you can invite me. I'll come and defend you. But seriously speaking, you have to be firm. I always like to empower new moms, especially first-time moms, because people try to push you over. They all know better. No, they don't know better. Most of them don't know nothing. And most of them are teaching wrong things, because I see it even on ATP. We see people coming to the group and trying to answer our question with all this nonsense, and most time we just boot them out. So please, most people, the fact that they are older or grandparent does not mean they know better. When it comes to death or baby, health issues are changing all the time. What works for them may not work for you now, and that's why most children were dying so much in those days, because people don't know better. So don't let anyone force you to do the wrong thing. Okay, when it comes to your baby, that is your most prized possession. Don't joke with it, and be very firm. Every other thing else can go. Health issues, no. Be very firm. I hope I've encouraged the first-time moms today to be very firm. Apologies to all the grandparents and grandmothers on the line, but I really want you to just let the mothers let them follow what the pediatrician tells them to do. All right. Thank you so much. We appreciate your love and your support. All right. Somebody is asking a question about menstruating. I think I've answered. When I urinated, I saw clotted blood in your urine and all that, and I've not given back. You need to go and see your gynecologist. Okay. It's not infection, but you need to go and see your gynecologist. If you are bleeding outside your normal period, that is not normal. You need to see your pediatrician. Okay, somebody said my question has not been attended to. I doubt. I think I've attended to every question. So if your question has not been attended to, please post your question on our Facebook group and we will answer them. I have answered every question I've seen. So instead of you to say my question not be attended to, just put the question back again and I know which one it is and I can say I've attended to it. if you leave and come back, you may want to listen to the video all over again, and you get your question attended to. All right. 6 months is having high discharge. You need to see the doctors. Sometimes, if it's recurrent, we need to take the eye discharge. We need to send it to the lab. We need to know what bacteria or germ or whatever it is, and then that will tell us what is the best drug to use. So you need to go see. But more importantly, make sure. Let me just start by saying that make sure you are not applying powder, because a lot of you put powder on these babies' faces all the time. It is absolutely not necessary, and most of them enter into the eyes of the baby, irritating the eyes of the baby, causing all this discharge. Some of you put this oil 100 times a day, and it's dripping down the face, it's going to the eyes, irritating the eyes. So make sure you stop all those ones first. There is nothing that needs to go on the face, really. Just your oil or cream on the skin, but anything like powder, anything like oil on the head all the time that can go into the eyes, you need to stop it, because those are the things that normally irritate the eyes and will cause all this eye discharge. So make sure you are doing the right thing first. If you are doing the right thing and then the child is still having the eye discharge, then make sure you also wash the children's hands, because most of them, they're always rubbing their hands with their eyes and they've touched all the dirty stuff. And then, so sometimes washing hands is also for children. Wash their hands often. And if you are still having the high discharge, then you need to see the doctors, and then they can take it up from there. All right. So I think I've answered all the questions that came before 7 o'clock, because I told you it's already 7. We need to close. Today's the last day. So I don't want us to. Okay, I don't have any question on Instagram. That's great. Great. I hope I didn't jump anybody's question on Instagram. Okay. Your baby will be 3 months on Saturday. Okay, that's not bad. Okay, fine. Yeah, but then even then, I'm still worried about the weight. Just watch for now. Okay, so because today's our last day, I'll just answer all the questions that have come in. I don't have, though it has stopped. I can't remember what this question is. So if you are asking questions that as a Facebook user, you really need to be very careful, because I won't know which one is your first part, which one is your second part. So you have to make sure the question is complete. So, Ebitoya Adetola, what was your first question? Okay, that was you are the one that asked about rota. Okay, yeah. If you're the one that asked about rota, maybe it's still 2 months, you can still go for rota. The latest you can take the first dose of rota is 15 weeks. So that's almost like 4 months. And the latest you can take the second dose is 8 months. So you still have enough time to take your 2 doses, okay? So no problem. You can still, maybe you still have time. So go get your rota, no problem. All right. Okay, if your people give vitamin K at birth and it's still bleeding, you need to go back. Then they seem to give another dose of that vitamin K, because your child is still bleeding. It's important. You need to go back. So sometimes we give some people IV instead of IM. Normally what we give every baby is IM, but some babies will still bleed and we have to give them IV. So, but you go back and your doctors know what to do. Okay, I think I've answered this eye discharge question. I don't know what this, I don't have, though it has stopped. I don't know what that means. How often can a preterm baby from 2 kg have a bath? Once a day, preterm, term, every baby, once a day bath is enough. At least for those of you in Nigeria, even for those outside Nigeria, if your area is cold, twice a week or 3 times a week is fine. Please, bathing is overrated. You don't need to bath baby all the time. They are not dirty. They don't need all those extra, but honestly, trust me, they don't. Just, you can wipe your baby and clean them. You don't have to take them through the proper bath thing. So that's it. 5 months can grab things, but can't get a firm hold on things and they fall off. If your baby is safe, if they are still falling off by 6 months, see a pediatrician. Okay, a baby checking, always put the age of a child in every question you are asking. A checking baby in a newborn is different from a checking 5-year-old. So you really need to be always putting the age of your child in every question. Olive oil does not cause cradle cap. If your child is going to have cradle cap, your child is going to have cradle cap. Olive oil is actually the treatment as part of the treatment for the cradle cap, but it's not the cause of cradle cap. cough, I think I've answered all the cough questions today. No drugs, no drugs, no drugs. I've answered the question about olive oil causing critical cap. The clotted blood dropping, I've stopped and I don't have it. So if you don't have it anymore, then why are you still asking about it? So, but like I said, if you are worried about anything about that, then you have to see your doctor. But if you are not having it anymore, then you don't need to worry about it. Just let it go. All right. Okay. I think I got see all the questions answered. So thank you so much, everyone, for watching. Thank you so much. This is the last broadcast for 2022. Yay! All right. It's been wonderful coming here every Monday, answering questions. Thank you so much for those of you who have been consistent. I think Shami for King is the most consistent person on Instagram. I remember your name quite right. And this on Facebook as well. Thank you so much. We will be going on break from next week till January. So I'll see you 9th of January 2023. So because I won't see you again, I just want to wish you a wonderful Christmas and a happy New Year 2023. During the holidays, please keep our children safe and healthy. Please, let's be child safety conscious during this period. I know it's a time of festivity, but please, we need to monitor the children. All right, children can very adventurous, very inquisitive. So lovely traits, but also can get them into a lot of trouble. So please keep our children safe. If you are planning to travel, please go with the medication that your children will need. Please know the nearest hospital to wherever you are going. I don't want to hear I'm in the village. Oh, I don't know which hospital you. That maybe will not be online to answer your questions. So I know most of you will come to my inbox, but I won't be there as well. So please, as you are going to the village, go know which is the nearest hospital. Ideally, you should have an health center within 30 minutes of any location in Nigeria. That's the ideal thing, but we all know it doesn't always work like that in some villages. So as you are traveling, be on the lookout, which is the hospital if there's an emergency. We don't pray for an emergency, but it is be foolishness not to know what to do if there is an emergency. So you must know an hospital that is 24 hours. You must know the distance from it to your village. You must know how to get there, even if it is the middle of the night. Okay, I don't want to hear I'm in the village, there's no hospital. You must find one. So if there is no hospital, then maybe you should not go, and maybe you should not take your children with you. Honestly, and I'm saying this with all sense of responsibility, and I'm not joking. So if you are going to travel, make sure you have all those preparation. Make sure you go with emergency drug, your paracetamol, your ORS. A lot of people are going to have diarrhea, eating too much of those food. Make sure you go with all those things. So, and be prepared. But more importantly, let's keep the children safe during this festivity. Keep them safe, monitor them, don't leave them alone. Okay, and avoid them in the kitchen. No children in the kitchen. All right. No children in the kitchen. Let them stay in the living room, wherever. No children in the kitchen. Absolutely not. All right, because burns is a risk during this period. So please, no children should be in the kitchen during this festivity. All right, so keep our children safe. If you have any question during the holiday, our group will be open. You can just type in your question and you will get the answer. You can watch our past videos. There's hardly any question that is new under the sun. I'm sure we would have answered them. If you just put in the keywords in those questions, I'm sure you will have answer. If you go to our website, if you will look at all the various topics, I'm sure we've written something about them. So you can always use that as your backup, for if you have questions, you will be able to search our group, be able to get answer. But just that none of us will be there to do this kind of face-to-face or answer your question, because we too will be having lovely fun time with our families. All right, so thank you so much, everyone. So if some people are just coming after 7 asking questions, please, I won't be able to answer your question again, but no problem. You can still post your question on our Facebook group now till Saturday 17th of December. You can still post your questions and we will answer all of them. But from 18th of December, which happens to be my birthday, Sunday, we are not going to be available anymore. But we'll see you in January 2023 by the grace of God, God willing. So once again, have a wonderful Christmas. Have a happy New Year. And it is bye. I'm sorry, my moderator has some technical issues, but I'm sure on behalf of Temi and myself, we wish you a wonderful evening. Bye.